So, sir, what chemicals are now effective against COVID-19?
See, most of the chemicals which we are using for a normal clinic is definitely effective in the COVID-19. Only slight things have changed in COVID-19 is we have made sure that the clinic doesn't contain much of these materials or the equipments or the instruments lying on the table surfaces or on the open surfaces in the clinic, because initially we used to have sterile pouches, everything on the cabinets on top of it. We used to make sure that things happen. But now, because of this COVID-19, which is very much aerosol in the air and remains in the air, it can contaminate every surface. So first and foremost thing, we need to make sure that the surfaces where we are using for the cement for mixing or the equipments where we are keeping all should be all in the closed cupboards. Nothing should be open. That's the first thing. Second thing is we started using more of a bacillal solution, which is special for all the surfaces and the chair and everywhere, so that the aerosol, whatever is sprayed when the treatment is done, doesn't get stayed onto the equipments and the handpieces, as well as the trays and the handles and all those areas, which is difficult to clean all the time. So these sprays are very much helpful in doing it. Third thing is the wet wipes. The wet wipes are very good in cleaning surface because you don't have to worry about what is the dilution, what is the concentration you are using, whether it is properly going to affect or not, because it has been perfectly done for a single use, for a sterilization and making the area clean, and disinfectant the solution is perfectly done in that pouches as well as the wipes. That's the best thing. The other thing like sodium hypochlorite we were using before, but now the intensity. One second thing is the number of times used in the clinic has increased because of this COVID-19 can be stay in the floor, and that can be again spread in the air when the movement happen because they get dispersed. It is better to use continuously for every cases after then wiping the surfaces and doing it, and use all the quaternary ammonium compounds, making sure that all the things are taken care. And hydrogen peroxide papers also you can use in the clinic for a defogging, so that things are taken care. These are slightly more for the COVID-19 ones we have seen, because to make sure that they don't get cross contaminated.